Why are blind finger sweeps not recommended in infants with foreign objects in their oral cavities or airways? A. They may injure the oral cavity. B. They may force the object in deeper. C. They may trigger a gasping reflex. D. They may trigger a vomiting reflex. The answer is B. They may force the object in deeper. Blind finger sweeps are not recommended in an infant with airway restriction due to a foreign object because they may inadvertently force the object deeper into the airway. A finger sweep should only be used if the object can be visualized. Injury to the oral cavity would not be a primary concern in the case of airway restriction, and a finger sweep would not be expected to trigger either gasping or vomiting in an infant. All of the following are forms of shock except dash. A. Cardiogenic. B. Hypovolemic. C. Anaphylactic. D. All of these are forms of shock. The answer is D. All of these are forms of shock. The four main categories of shock are as follows: cardiogenic, sudden inability of the heart to pump sufficient blood to the body, most commonly due to acute myocardial infarction. Hypovolemic, due to loss of fluids or hemorrhage. Septic, also known as entotoxic shock. Dangerously low blood pressure as the result of systemic inflammatory response to infection. Anaphylactic, systemic inflammatory response to an allergen. What is the normal range for hemoglobin levels in an adult female? A. 12.1 to 15.1 gram per deciliter. B. 4.0 to 9.0 gram per deciliter. C. 14.1 to 21.1 gram per deciliter. D. 8.1 to 13.1 gram per deciliter. The answer is A. 12.1 to 15.1 gram per deciliter. The normal range for hemoglobin in an adult female is 12.1 to 15.1 gram per deciliter. Hemoglobin levels above that range may be indicative of chronic low blood oxygen, while lower levels of hemoglobin are seen in anemia. What is the normal range for hemoglobin levels in an adult male? A. 10.7 to 15.7 gram per deciliter. B. 13.6 to 7.7 gram per deciliter. C. 16.6 to 22.7 gram per deciliter. D. 18.7 to 23.7 gram per deciliter. The answer is B. 13.6 to 17.7 gram per deciliter. The normal range for hemoglobin levels in an adult male is 13.6 to 17.7 gram per deciliter. Hemoglobin levels above that range may be indicative of chronic low blood oxygen, while lower levels of hemoglobin are seen in anemia. What should you expect to hear when percussing the seventh intercostal space along the right midclavicular line? A. Dullness. B. Hyperresonance. C. Tympani. D. Resonance. The answer is A. Dullness. When percussing the seventh intercostal space along the right midclavicular line, you should expect to hear a dull note, as this is directly over the solid mass of the liver. The border of the liver can be found by percussing in a descending line along the intercostal spaces of the right midclavicular line, starting at the clavicle. The superior border of the liver can be measured at the point where percussion transforms from resonant or hyperresonant, indicating the air-filled lung, 2 dull, indicating the solid mass of the liver.